Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to healthcare. For the month of October, we're focusing on the intersection of healthcare and artificial intelligence. Nurses Drew Herbert and Matt Farmer are researchers at Mizzou who've been testing to see if generative AI large language models could be a helpful supplemental tool to professional therapy for pregnant people with opioid use disorder that are ready to seek care. Here's Drew.
The thought stemmed from my own clinical work, treating folks with opioid use disorder and also treating pregnant people, pregnant women with opioid use disorder, and prescribing them a medication called buprenorphine. And in the treatment of substance use disorders more broadly, there's a particular therapeutic approach that's evidence-based and that a lot of clinicians, therapists, folks use. It's called motivational interviewing. And so, when Matt and I started talking about large language model conversational agents, there just seemed to be a really good fit to say, I wonder if that tool could be tuned, trained, programmed to be able to essentially offer motivational interviewing. Reflecting on my work with pregnant women with opioid use disorder, that just kind of seemed like perhaps a natural fit.
And so I think our conversation really led to, motivational interviewing is totally within the capabilities of language models. They mimic human language really well. When you provide them context, they do even better. But we have limitations and we also have unknowns. And so this is actual active research. We need to test and know, is a language model going to do well? And that's really important information for future research, for future applications, when we're actually dealing with real people, real situations, to understand, are these models that are fancy and can help you rewrite an email, do they have safe, effective, trainable utility for specific people in specific situations that have health needs?
And so those were the three things that we really looked at in this study: was safety, accuracy, and relevance. Because the question we wanted to answer was, can this model be steered in a way that produces output that is those three things, right? That is safe, that is accurate, and that's relevant. And I would say, at least from my perspective, I was very surprised. I was just looking back at the data right here. So I think I said in 96.7% of cases, data were accurate, safe, accurate, and relevant.
I would add the availability and access is a strong reasoning for utilizing AI and researching it, because there's a shortage of trained mental health professionals, and an increasing demand for mental health services. And if somebody is ready for change at 1 a.m, they're less likely to have access to a person at that time, but they would have access to a technological model that's online. There are limitations with who is online and how do they access it, and do they have the digital literacy to actually work with a model like that. But those are other barriers outside of, if you do interact with the model, is it good? Does it give you what you need and help you get to that next stage in your journey?
That was nurses Drew Herbert and Matt Farmer speaking about their research, looking to see if AI chatbots could be helpful supplemental tools for pregnant people with opioid use disorder looking to get into treatment. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.